Hi, everyone. Thank you for tuning in to our executive summary overview of our employee wellness program that we have here at Western Technical College. I'm Ryan Monroe, the wellness manager at Western. Kind of to show you through what we've found from our survey that we've conducted, and also provide some more information about the details of our survey and the impact of our evaluation process here. Just to get started here talking about our program overview, our vision of our program is to improve the health and well-being of Western employees, and that's all Western employees that we have here, whether it's part-time or full-time. Our mission with the program is to provide the education, resources, and supports in a health-promoting culture that improves the overall health and well-being of our employees. So a couple key pillars are the education, resources, supports that really go into our program that we need to develop to make the program effective for our employees. Our incentive program is a key component of our overall program. This focus really has two pillars. One is to encourage employees to seek medical oversight. I'm not a doctor. We aren't going to provide the medical service on site. This is something that we want employees to have a close working relationship with medical professionals. Things like dentistry, regular care providers, things like that, preventative screenings, counseling. And our second pillars are things that we have more control over, and encouraging employees to practice prevention, well-being activities such as exercise, stress management, healthy diets, safe transportation, things like that we really focus on. With our employee wellness program, we do have several goals that we want to keep in mind. For one is we want to provide incentives to motivate employees to live healthy lives. We know that incentives are effective for getting employees to change behavior. And so we want to make sure that that's a key pillar of our program. We want to help employees improve their overall health and well-being. That's our utmost important goal that we have. Providing a variety of opportunities for employees to participate. So we don't want to necessarily get into a component where we are forcing them to do certain things from an employee wellness standpoint. We want them to have the freedom and the choice to do what they want to do with their own health and well-being to improve that. We want to provide employees with a full control over how they improve their health and well-being to earn the incentive. So there's a cafeteria style approach that we have with our incentive program that employees can participate in. And lastly, and probably the most important with the employee wellness program, is oftentimes they do get a bad rap for the only focus of the program is to save the organization money. That is totally not the case in this scenario. Although it can potentially be a good byproduct of the program if run effectively, it's very hard to identify that. And more importantly, that's a lagging indicator. We first and foremost have to improve the health and well-being of our employees first before we can start to see those savings down the road. Our incentive plan, as you can see here, it is a cafeteria style approach, so employees choose how to earn their full incentive. So they have a variety of options here, as you can see on the right hand side. They can earn up to a total of $500. It acts kind of like a bank account, so they earn what they put in throughout the year towards that. There's over 21 activities that they can choose from. Activities can be duplicated unless otherwise noted. So for example, we're not going to encourage employees to go and get 3 or 4 flu vaccinations. That probably isn't the healthiest option for them to be able to do. So that's capped at 1 per year. But they can submit multiple fitness logs. They can submit multiple stress management logs, as many as they want for that, to be able to improve their health and well-being the way they want to go about doing that, no matter what age they're at and what stage in life they are. So looking at our primary evaluation, so we're in the infancy of this program. This is the first year of operation. We're about halfway through. We're in month 7 right now. We've done a variety of participation evaluations and reports. We've done employee interest survey with it, so really collecting a variety of data. This survey that we conducted and the evaluation question that we really wanted to identify was focusing on our incentive program. And identifying is our current employee wellness program incentive categories effective at meeting the needs of staff here at Western. So are we aligning what is important that our employees value and feel and aligning those with opportunities, removing barriers, and making sure that there is a connection and a link for our incentive program. Looking at the design, collection, and methods for our survey, we did use Google Forms. It was developed by me as a wellness manager. We made sure the survey was anonymous for all participants and that all participants were over the age of 18. The questions focused on current incentive categories that we have. of these questions, there was 3 demographic questions that we will highlight here in the next couple slides, 5 multiple choice questions, and 2 open-ended questions. So it's a very brief survey, but provides us very valuable information. The reason we do have it as a brief survey is because not too long ago we did a more thorough, in-depth survey that really highlighted the needs of employees, and so we didn't want to provide too much survey fatigue with this new program, and wanted to make sure that we could get the most highly impact information that we needed. The survey link was emailed out to our stakeholder group, and our stakeholder group is a subpopulation of our total employee population. It makes up our wellness committee, our wellness champions, who are basically grassroots level leaders of the program that are embedded throughout the organization that serve as communication streams for the program and the committee, and kind of feelers as an extension of the committee to provide information back and forth from their employee areas. And then lastly, middle management. That's going to be a key pillar for the success of our program as well. When we look at the analysis, we did compile data using Google Forms. Okay, we looked at demographic data broken down by age group, gender, and common work type, whether that be office work, clerical, faculty, and areas, and really tried to identify where they were located to be able to identify different trends in the population areas. Multiple choice responses were narrowed down to the top 3 most selected, as we'll highlight here. That gives us an idea of what are the 3 most common areas for each question. The open-ended responses were coded and analyzed to identify the common response categories and be able to start to kind of identify common themes that way. When we look at our survey and our stakeholders and completion percentages, our stakeholders, as mentioned, were our wellness committee, our wellness champions, but then also looking at our middle management as well. So our stakeholder group had 106 stakeholders out of our 438 total employees, which is about 24% of our total employee population. Okay? Of that 106 stakeholders, 77 completed the survey. So we had 73% participation with our survey, as you can see here from the graphs that we have on this slide here. So again, we had very good participation with 73%, given that it was only open for about a week. We did have a good push and a good focus with it, which is awesome to see during this time, and that there is good engagement with our stakeholder group here. Our demographic results here, as you can see, and I'm not going to run through this, but as you can see, it's highlighted from top down, the most percentage. So it does go in order. So the highest participation was the 51 to 60 age group. Primarily female, which isn't all uncommon for surveys that we do here at Western. Typically, females do have a higher participation range. We had more faculty participation, which is awesome because our organization historically has had a broken link with faculty and our overall administrative procedures that we have. So this is great to see that we did have good faculty input for the results of this survey. So looking at our first question from a multiple choice standpoint, we asked, what activities have you participated in thus far? So what we were looking to identify is, what was the most participated categories? What we found is that seminar attendance was the most. This wasn't surprising to me, given the recent months of having to work remotely, and a lot of our activities and events that we were going to host and hosting in person had to either get pushed off or had to be done in a remote environment. So we've done more seminars, and this has been kind of one of the primary ways for employees to participate. The second one was a health assessment. So this is something that is on our employee intranet site. It is basically a health risk assessment. It's a short survey that they can take and questionnaire that they can take that identifies health risks, but then kicks back information of what they can do to improve their health and well-being. And the last one was a safe transportation pledge. This was one that was just simply a form that they go through, they highlight, and it reads and shows them kind of the impacts of unsafe driving, not wearing seatbelts, things like that. They then also sign it, and they submit that for their incentive documentation. These aren't that, from what I have seen with these, things that I have identified is that many employees during this first half of it were looking for easy wins. They were looking for things that they could do to get participation incentive dollars. And they've done that through seminar attendance, health assessment, safe transportation pledge. In the further slides, we'll identify a link. We want to identify what's most important from a health standpoint and participation. We want those categories to match up. So we'll see here in the next couple of slides whether that does that. With our incentive categories, we also wanted to identify what categories were the most difficult to complete. We want to know that because we then have to put higher dollar amounts for the most difficult ones, or find ways to encourage employees through marketing promotions of these to get higher participation rates. What we found is disease management programs were the most difficult to complete, whether that was because of the financial cost of it, whether it was because they didn't have a disease at the time. Really could be on a variety of levels of what the most difficult was. And that's something that we could definitely dive into, of what was the sole reason for that getting the #1 ranking. The one that really concerns me is professional counseling. And the reason for that is because in a time right now with stress so high, with COVID and people being remote and isolated, we want professional counseling to be one that's an easy one to obtain, one that is of high value, and one that people are doing it. And I think one of the reasons we don't is because of the stigma behind counseling. Historically, we in the organization have tried to overcome a stigma of counseling and being able to eliminate barriers for people to be able to participate in that. And then lastly is preventative screening. Okay, so that we want to make sure to identify that as well. Question 3 is, what categories do we feel are the most important from a health standpoint? Our employees, or our stakeholder group, said that annual physicals were the most important, which is extremely important. Second was our healthy living logs. So our healthy living logs are things like fitness logs, stress management logs, and nutrition logs. So those are our daily activities that people do for prevention and well-being activities, which is awesome to see. From the most important, that's the daily activities that we're doing to improve our health and well-being. And lastly, not surprisingly, is weight management. When we think about employee wellness programs, so many people go directly to the weight management piece, but that's not necessarily the sole reason for the employee wellness piece. It's an important part of being in a healthy weight, and it impacts a variety of the other categories, but not necessarily the most important from that standpoint. But again, good information from the most important. What we see though, and what concerns me, is that we are seeing differences in what our employees are saying as most important versus what we are seeing as what is being participated. Largely, which could be because of the area of the time with COVID and inabilities to be able to do certain things during that time period. The last one, and probably the most important one, is a question of value. So selecting the top 3 categories that they feel offer the most value. When we talk about value, this is a combination of our health importance, the dollar amount for the incentive, and their ability to complete it. So looking at the difficulty. Again, coming in at #1 is that annual physical. What we did see here then is that weight management actually jumped our healthy living logs. Our weight management program is offered at a higher dollar value than our healthy living logs, but it takes longer to be able to do that. Okay, and it's more outcomes based, where our healthy living logs are more participation based. So again, good information. We see good data from what's most important and what's most valued, which is good to see. That means that our incentive program and our incentive dollar amount are about the right level for this. So again, just some different opportunities that we see to be able to evaluate. Looking at our open-ended questions, we asked, what barriers prevent you from participating in the incentive program? What they found, and what we were able to code and be able to identify, is that workload is the #1 reason. Employees feel that they are overworked. Okay, so we need to identify and share this information with human resources, obviously doing it in an anonymous way of sharing this report, but looking at it and saying, hey, here's what our employees are telling us are barriers to be healthy. Okay, and a lot of this is opportunities that we can overcome as a program and work around as an organization. So we want to make sure that we take these into consideration to make sure that employees have the resources and supports to be effective with their overall health and well-being journey. And the last one, open-ended question, is what is the best way for Western to help employees live a healthy lifestyle? Again, they noted that it was workload related, so reducing workload, allowing for more flexibility, healthy workforce initiatives, so having more healthy opportunities here at work, financial discounts, paid time for wellness activities, and then lastly was support, which was one that was a common theme on